Hey, thanks for making it to Veterans Info Tap. Glad you made it today. Today's topic is, at a very high level, mental health ratings. How many ratings are there? How many ratings can you get from mental health, for mental health, right? So usually the answer is 1. That's usually the answer. So the question is there really only one rating that you can get for mental health? And I'm going to answer that. But first I want to explain the reason why everybody says 1. If you've read anything or talked to anybody about mental health conditions. So the way mental health conditions work is not like the rest of your body. So the rest of your body is, I hurt my elbow, I hurt my knee, and my back is bad, and I have migraine headaches. And you would get a rating for each one of those things, provided, obviously, that you meet all the criteria. You have your time in service, you have your diagnosed condition, and you have your nexus link between those two. Remember, the link is not that the military caused it, but rather that it occurred during your time in service. Now, the military could cause it, which automatically makes it during your time in service. So that's easy. Your migraine headaches, right? Manifested during service. The military maybe didn't have anything to do with it. Your GERD, maybe you have GERD now, and it manifested during your time in service. Maybe the military had nothing to do with you getting GERD, right? So provided that you met all that stuff. You would have all these different conditions that you got rated. Mental health works a little bit differently. What they do is they'll diagnose you for all kinds of things, right? Well, I mean, if you have those things. So let's pretend for a second that you have PTSD, you have depression, you have anxiety, you have insomnia, which is also rated as adjustment disorder, which is under mental health. And just for kicks, let's say schizophrenia. So now you have these 5 mental health conditions, okay? 5. But the VA is not going to rate you for each one of those and then go, here's your ratings. What they're going to do is they're going to lump them all together into a melting pot of a schedule of ratings and then look at the combined signs and symptoms and issues that you have regarding all of your mental health conditions. So I hope that makes sense. Then what they'll do is they will then get all of these signs and symptoms and issues and all these different things that are going on, and then they're going to slide you over and sit it next to, not you physically, but your information, next to what they call the schedule of ratings. They're going to open up the schedule of ratings and they're going to go down and find the book that is mental health. Inside the schedule of ratings, there's a bunch of different books, right? So there's one for musculoskeletal, there's neurological, there's mental health. So now you're going to go into mental health, you're going to open it up, and then they're going to read the schedule of ratings. The schedule of ratings is the book that will guide the veteran rating official on where to rate you. Are you a 30%? Are you a 50%? Are you a 70%? Are you a 100% rating for your mental health? So they're going to sit there and they're going to open up this thing and they're going to read each line for each rating, right? So they're going to read whatever, the 30% rating schedule. They're going to read that paragraph of signs and symptoms and durations and whatever in there. They get through that, and they're looking at your information that got provided through the CMP exam, through the questionnaires that you had to fill out, through the VA's filing process for mental health. And they're going to look at all that stuff, and they're going to compare and contrast. And if you meet all of those things, they're going to go to the next one, 50%. And they're going to read all of that, and then they're going to read all your stuff again and make sure that if you meet all of those things, and if you meet all of those, then they're going to go to the next one, 70%. And they're going to read all of that and then go back to your stuff, right? You get the point. And then if you don't meet everything in that 70% area, then they're going to bump back down to the 50 and rate you at 50%. Now, sometimes, not all the time, but sometimes in the mental health world, we will bottle things up a little bit and maybe not talk about it or downplay some things a little bit. This is not the time to do that. This is the time to just let it all out, really, so you can make sure that you get rated appropriately, because I will tell you, there is nothing worse than going through it halfway in and still feeling the pain of going through it all Because that's the fear, right? The fear is the pain of going through it and filing it and dealing with it and talking to people about it. You'd rather just move on. But you know there's some gold at the end of the road, and it's going to help your life. So you go. So you go and you get some treatment, which is also good and helping you too, and you're meeting other people and all that good stuff. But you need to let it all out so that way you can get the appropriate rating, because what you don't want to do is get a lower rating and then realize you got a lower rating and then have to circle back around and file an appeal and then go through the whole process again, right? So with that, now from a 70, you don't meet them all, they drop you to a 50, they award you that, cool. So now that's your rating for mental health. So you have one rating for those 5 conditions. Well, there is another rating for mental health, and you can have multiple ratings for mental health. Go figure. So smaller percentage, very small percentage, but it's important for people to understand that this is out there. And even if it's not for you, right? Now all of a sudden you're a resource for our brothers and sisters to say, hey, did you know? Blah. Right? I will tell you that our community is one of the best communities in the sense that for the most part, we got pretty thick skin and we can tell each other like it is. And it's like, hey, look, no hard feelings. I know it's a tough conversation, but hey, you should check this out. Because we're kind of no BS about stuff. And it's really about making sure that we're taking care of it at the end of the day and it's coming from a good place, right? So the other mental health rating schedule is for eating disorders. So like bulimia or anorexia, if you have one of those and you have these other ones, you could effectively have 2 rating decisions. Now, very important to know that those exist, because if you did not know, you could not be partaking in that rating that you should have. So the bottom line is that knowledge is power, and the more that you know, the better off you'll be. So if you or anybody you know has any sort of eating disorder, which I will tell you, with the military, as we all know, with our PT test, all that good stuff, weight standards, you don't meet weight, now you're getting taped. That can, for some people, that can cause some issues. And there's nothing wrong with the person that happened to. I mean, it's just everybody processes things differently, and the consequences are different for everybody. I personally struggled with I feel like I could eat a bag of peanuts and gain 15 pounds. So, I was constantly doing this, just trying to stay where I needed to be. Never was overweight, but in my own mind, I wasn't where I really, felt like I should be compared to some others. So I can see how people can have these types of disorders. So with that, I'll go ahead and cut it there. I really appreciate everybody, and remember that there's 2 rating schedules for mental health. There's all the mental health stuff, and then there's eating disorders, which are kind of carved down to that, and they have their own rating schedule. So thanks again. I appreciate each and every one of you. And remember, if we don't take care of each other, something went wrong.